I'm Greg Nichols, a subject matter expert with the Homeland Defense and Security Information Analysis Center, and today we're talking about the flu. Influenza, more commonly known as the flu, is an infection caused by a virus, the influenza virus. Probably you, or even somebody you have known at some point, has had the flu. So let's talk about why this is such an important issue. Influenza is a dangerous virus for a number of reasons. First, it spreads very easily. It's spread by droplets through a sneeze or a cough. The influenza virus particles actually travel with the droplets and are inhaled by people nearby, and it can settle deep into their lungs. Global air travel has actually made the spread of the flu even easier. Second, the flu can have some serious complications. It can cause pneumonia once it settles into the lungs and can lead to a heightened immune response. In fact, an average of 700,000 people in the United States go to hospitals each year for influenza-like illness. The flu can also cause somewhere between 12,000 to 56,000 deaths in the United States each year. The flu can cause pandemics, such as the 1918 Spanish flu outbreak, which infected 500 million people worldwide and killed 50 to 100 million people. Third, the flu isn't necessarily easy to diagnose or treat. The virus can mutate very rapidly, and there are multiple types and subtypes, so it's difficult to make vaccines that are 100% effective. Work is in progress to develop a universal flu vaccine that would be effective against all different types of the influenza virus. There are laboratory methods used to diagnose the flu, such as reverse transcriptase polymerase chain reaction. But these can take some time to get results. Rapid tests are available but aren't always as accurate as some other methods. Some more accurate and timely paper-based disposable tests are being developed, but more testing and development still needs to be done. Medications such as Tamiflu can help shorten the duration of symptoms, but the supplies of some of these medications are dwindling after a tough flu season. Since DoD operates all over the world, they must constantly know how the flu is impacting their operations. So let's talk about how DoD fits into all of this. DoD operates the Armed Forces Health Surveillance Branch, which helps track cases of the flu and works with the Centers for Disease Control and Prevention to coordinate necessary responses. During an active flu season, apart from CDC, DoD plays a leading role, especially during a pandemic, by assisting with laboratory diagnostics, transporting response teams and supplies, and supporting quarantine enforcement if needed. DoD operates globally, so it has to consider outbreaks all around the world at any time. The flu typically occurs in temperate regions during the winter, but it can occur in tropical areas all year round. DoD and some individual branches have policies on vaccinating against the flu. Keeping the warfighter healthy during deployment in confined spaces, such as surface ships and submarines, or in remote areas like forward operating bases, can be challenging, especially when shipping supplies of vaccines to some of these locations. Thanks for joining us today. For more information about the flu and how it impacts DoD, check out our website, HDIAC.org, and don't forget to follow us on social media.